Once again, my presentation talk about rheumatic disease of the brain, cerebral and rheumatic vasculitis, Chorea and pathogenesis, pathological and anatomic and clinic and treatment. Rheumatic fever. Rheumatic fever is a disease that may develop after an infection with group A Streptococcus bacteria, such or silk fever. It can cause severe illness in the heart, joint, skin, and brain. Cause rheumatic fever is still common in countries that have a lot of poverty um, and poor healthy systems. The abnormal actions seasons to almost always occur with strep through the cerebral fever. Strep infections that involve all other parts of the body don't seem to trigger the rheumatic fever. Next, symptoms. Rheumatic fever mainly affects children aged 5 to 15 who have had a strep throat or second fever. It occurs, it develops about 14 to 28 days after the illness. Symptoms can affect many systems in the body. General symptoms may include fever, bleeding, pain in the abdomen, heart problems, which may have no symptoms, or may lead to the shortness of the breath and the chest pain. Symptoms in the joints can cause pain, swelling, redness, and warmth mainly occur in the neck, elbows, and ankles and wrists. Change or move from the joint to another. Next, this may include blood tests for reported strep infection, such and HO test, completed blood count, BC, electrocardiogram, serotonin rate, a test that measure information in the body. What are the neurologic complication of rheumatic disease? The main neurologic main infection Syndham Chorea (SCC) result in movement disorders and complex neurologic symptoms. Rheumatic heart disease may also indirectly cause neurologic complication with the ischemic stroke and septic embolism from infective endocarditis. Next, cerebral rheumatic vascular. Rheumatic vascular is an unusual complication of Lorenz severe rheumatic arthritis, while RA affects the body joints. Vasculitis is condition in which blood vessels become inflamed. Rheumatic vasculitis occurs in approximately 2 to 5% of patients who have RA. Symptoms like new severe headache, stroke, or transient ischemic attacks significant for source or confusion, weakness, uh, especially of the limbs, loose, loose plants, and the kids disturbance, vision, loss, seizures, type of vasculitis, large vessel, vasculitis, large vessel. Vasculitis affects the body. Large arteries include the aorta and the carotid arteries. Medium vessel vasculitis. Medium vessel vasculitis affect the medium blood vessel in the body. Small vessel vasculitis. Okay, next, Chorea, pathogenesis and the pathological anatomy, clinic, treatment. What is the pathogenesis of the syndrome Chorea? Cerebral Chorea results from an autoimmune reaction against aberrant Pathogenesis infection where the body from antibodies against antigens of bacteria known as epitopes. Similar epitopes are found in basal ganglia and the area in the brain which contains movements. Pathology of chorea, chorea is movement disorder that results from a basal ganglia injury due to variety of causes in in children. Chorea is characterized by sudden brave vertical muscles contraction, causing movement that appear to the follow of body part to body part in uh, unpredicted manner. Clinical next, the, the majority of the patients are treated with neurologics which block uh, dopamine receptors. Other drugs that are used include uh, GABA, averinic agonists like valproate, clonazepam, and gabapentin. Both in my clinic and CRCOPM have shown problems in animals. Koreans that occurs from heart transplant, but my response to steroid and the plasmapheresis in my children, the occurs of Korea in patients with rheumatic fever. For the most part, the drugs only reduce the Korea in a few patients, and they also have potent adverse effects. Nearly, nearly cells transplasm transformation and is another example producer which has been used to test a few patients with humanitarian Korea, but its environment has not been seen in the patient in all patients. Next, anatomy of Korea. Korea is characterized by repetitive, irregular, small, uh, rapid involuntary movement that start in one part of the body and the movement probability unperiodically and often continued to another part. Typically involves the face, mouth, tongue, and the limbs. Treatment: there is no cure for the disease now. However, symptoms can be managed. Perhaps most important is evolution and the creation of the patient's support systems. As the disease progresses, that the patient will need subsidized caffeine, nutrition management is important due difficultly swallowing. The benzene has been uh, appropriate for treatment of chorea. Thank you for listening.